Hi, it's nice to see you. Do you mind telling us who you are?
Hi, Sofia. I am Mauro Cabral Grinspan, and I am the executive director of GATE, and I'm based in Buenos Aires.
Can you say a little bit about how or if COVID has affected you personally in terms of the city where you live, the communities where you work, the organizations with which you work?
Well, I live in a country that had had one of the longest lockdowns in the world. It started in March. And for me personally, it has been challenging because I haven't been able to see family here or to travel to Europe where my partner is. But on the other hand, I'm an extremely privileged person because my work is done virtually. So I have had no difference in that, just I spend more time at home. In terms of my community, the impact has been huge because not only in Argentina, but around the world, the trans people who are like the key population that GATE works with have faced a lot of issues related with the economic crisis, as many trans people depend on the informal economy, but also on the regulations on mobility, especially at the beginning of the quarantine in different places. And in other cases, people have faced the cancellation or the delay of gender affirming surgeries or access to treatments. So I would say that these are the three key points of impact of COVID in our communities.
So you say that the lockdown started in early March. Is it still going on in Buenos Aires?
It is going on. The country is slowly started to open, but basically because people are extremely tired. So we have a poor and weak public health system, or the health system in general doesn't have the capacity to deal with many cases at the same time. So basically what our government tried to do is to flatten the curve, asking people to stay at home and imposing a more like a stricter quarantine at the beginning over the first 2 months, 2.5 months, but slowly, and especially because of the economic pressure, it is started to open. We also have people complaining because they feel that from wearing a mask to some places not allowing people to go inside, like restaurants, there's a violation of their freedom. And many people are not being able to go back to work. Especially this is extremely painful for doctors and nurses in the country, as they have been working non-stop.
For sure. And when you were talking about for trans communities, the very kind of different ways in which COVID is impacting. So you were talking about the lack of access to surgeries that had been promised, or that seemed as though that they were going to be happening. Is that something that you see happening globally? Is that something that's more specific to Argentina? Do you know something about that?
It's something happening globally, and actually just a week ago, the World Health Organization published a list of like a report on essential services being impacted by COVID, and it didn't include gender affirming interventions, including access to surgeries and hormones. So it's a quite shocking thing, as it's usually happened with the trans community, or needs are not even taken into account in international monitoring. But trans organizations around the world are monitoring that impact, and it's happening everywhere. There is a different impact that is related with politics. This has been a period where different governments and political movements, and also media and social media, influencers associated with social media, have started to move towards anti-gender in general and anti-trans conversations and policy discussions. The pandemic has been economically and politically and in terms of mental and physical health extremely costly for our community.
COVID has hit everyone in all of our communities so hard. And, are there some lessons that you see that we as a society really should take from our experience during the pandemic? What do you think are like some of the key lessons that we really should learn from what's happened over the last few months?
Just to provide a bit of context, I have spent a lot of my professional life trying to deconstruct medical power over, our lives and our bodies. But also, I believe that with all the precautions in terms of human rights, but people need to not only trust in science, but to have a stronger science education and to understand how science works. And because this seems to be a very basic misunderstanding on how it works, what evidence is. For me, that's extremely concerning. I also believe that we really need to get engaged, like in terms activists, not only in the discursive aspect of designing public policies. We need to get into the budget discussions. And for health, for science, and we need to be part of that. And a key lesson for me is that we need much more money than we ever imagine if we want to have health systems really strong. And I also hope that I'm 48 now, but also that younger people that not necessarily see governments or nation states as relevant institutions to remember that the allocations for public budgets, for example, on health and education, are decided to that level, and that we need to engage in that conversation, because our survival in the future will depend a lot on how that money is allocated. The other thing that I hope is to see that all the different solidarity networks that we have seen emerging in different parts of the world, that will survive COVID, that we shouldn't need to start from zero again, but to keep, to expand them and to make them stronger.
Super helpful. Thank you. I really appreciate this.
Thank you very much for the conversation.